Psoriatic arthritis, PSA, is a type of arthritis that develops in people who have psoriasis. Psoriasis is a condition that causes patches of red, dry skin. Up to 30% of people with psoriasis will develop psoriatic arthritis. Psoriatic arthritis can happen suddenly or slowly over time. In about 80 to 90% of cases, it develops after psoriasis is diagnosed. Most people with psoriatic arthritis first see symptoms develop after the age of 30. Symptoms include fatigue, joint swelling and tenderness, and reduced range of motion. Sometimes fingernails look like they're infected and have a scaly appearance. Fingertips and toes tend to swell. Your joints may also feel warm to the touch. Psoriatic arthritis most often affects the following body parts: wrist, spine, especially the sacroiliac joints in the pelvis, fingers, toes, shoulders, knees, neck, eyes. If you're experiencing joint stiffness, pain, or swelling that persists, you should see a doctor. Blood tests. Psoriatic arthritis can't be diagnosed with a simple blood test. However, symptoms of psoriatic arthritis can be similar to those of rheumatoid arthritis, RA. So your doctor will probably order a blood test to rule out RA. The test will determine if your blood is positive for rheumatoid factor, RF. This is an antibody found in the blood of people with RA. Your doctor may also order a blood test to look for an elevated C-reactive protein, CRP, level or an elevated erythrocyte sedimentation rate, ESR. These tests aren't specific for psoriatic arthritis, but they indicate the presence of inflammation. Blood tests can also help rule out gout and osteoarthritis. If you have psoriatic arthritis, tests may also show mild anemia. None of these signs and symptoms alone can confirm psoriatic arthritis. Your doctor must examine all the evidence to confirm the diagnosis. Imaging test rays aren't always useful in diagnosing early-stage psoriatic arthritis. As the disease progresses, your doctor may use imaging tests to see changes in the joints that are characteristic of this type of arthritis. MRI scans alone can't diagnose psoriatic arthritis, but they may help detect problems with your tendons and ligaments. CT scans and ultrasounds can help determine progression of joint involvement. Joint fluid tests. People with psoriatic arthritis can be misdiagnosed with gout, a form of arthritis caused by too much uric acid in the body. Gout usually affects the big toes. Your doctor can take fluid from an affected joint to determine if it contains uric acid crystals. If these crystals are present, a diagnosis of gout can be confirmed. It's also possible to have gout, psoriasis, and psoriatic arthritis at the same time. Casper criteria for diagnosis. Diagnosing psoriatic arthritis follows the Casper criteria. The criteria are assigned a point value, with all having a value of 1 point except for current psoriasis, which has a value of 2 points. The criteria are as follows: current psoriasis outbreak, personal or family history of psoriasis, swollen fingers or toes, known as dactylitis, nail problems, like separation from the nail bed, bone growths near joint, that are visible on an X-ray, absence of rheumatoid factor, RF. A person must have at least 3 points based on the Casper criteria to be diagnosed with psoriatic arthritis. Treatment options. Once you've been diagnosed, your treatment plan will depend on the severity of your symptoms. For joints that are painful but not yet at risk of being damaged, over-the-counter, OTC, anti-inflammatory drugs may be recommended. These include ibuprofen, Motrin or Advil, and naproxen, Aleve. More severe pain might require a prescription anti-inflammatory pain reliever. Disease-modifying anti-rheumatic drugs, DMARDs, can save a joint from being damaged by psoriatic arthritis. Examples include methotrexate and sulfasalazine. These drugs might help to slow disease progression if you're diagnosed in the early stages of psoriatic arthritis. Some treatments can improve symptoms of both psoriasis and psoriatic arthritis. The success of these treatments varies from person to person. If you're diagnosed after you've had psoriatic arthritis for some time, this will affect your treatment decisions. Your doctor may prescribe an immunosuppressant to prevent flare-ups and keep your joints from being damaged further. Biologics such as TNF-alpha inhibitors are another treatment that reduces pain. However, they come with serious safety concerns such as increased risk of infection. Finally, if joint damage must be addressed more directly, your doctor might want to start with a steroid injection at the site of the affected joint. Cases involving psoriatic arthritis joint inflammation and destruction might require joint replacement surgery. Why you need a rheumatologist? There's no single test for psoriatic arthritis. It may take time to make a definitive diagnosis. If you have psoriasis and joint pains, your doctor or dermatologist may refer you to a rheumatologist. A rheumatologist is a doctor who specializes in diagnosing and treating arthritis. Be prepared to list all your symptoms, give a complete medical history, and tell your doctor if you've been diagnosed with psoriasis. Your rheumatologist will conduct a physical exam, and they may ask you to perform simple tasks that demonstrate your range of motion. Diagnosing psoriatic arthritis can be like solving a mystery. Your rheumatologist may perform tests to rule out other forms of arthritis, including gout, RA, and reactive arthritis. They may look for an elevated ESR or CRP level, which indicates some amount of inflammation. A rheumatologist may also order X-rays, MRI scans, ultrasounds, or CT scans to look for joint damage. Repeated flare-ups. People with arthritis can experience periods of increased disease activity called flare-ups. Symptoms of a flare-up include muscle and joint pain, and swelling. You may also have tendinitis and bursitis. In psoriatic arthritis, fingers and toes may swell up. This is called dactylitis. You may also experience pain and swelling in your wrists, knees, ankles, or lower back. Repeated flare-ups can help your doctor make a diagnosis of psoriatic arthritis. Times, a psoriasis flare-up will coincide with a psoriatic arthritis flare-up. Common triggers for psoriatic arthritis include exposure to cigarette smoke, infections or skin wounds, severe stress, cold weather, drinking too much alcohol, taking certain medications and foods that take away. Traditional medicine isn't the only treatment option for psoriatic arthritis. There are lifestyle choices that could make your condition more tolerable. These include changes in diet, specifically including more omega-3s, and adopting an exercise regimen. Maintaining a healthy weight, limiting starch, and taking steps to protect your joints can also help. Identify your flare-up triggers and avoid them. Also, your family history may indicate you have a higher risk for psoriatic arthritis, so keep that in mind. Psoriatic arthritis, when treated, can usually be slowed down to prevent further joint damage.